I'd like to speak about this from my perspective as adult social care and health spokesperson for our group. So we talked earlier about the Public Health England report into the impact of COVID-19 on BAME communities. And one of the recommendations from that report was to ensure that COVID-19 recovery strategies actively reduce inequalities caused by wider determinants of health. And it's not just racial inequalities we're talking about here, because we already know that we have a huge health inequality problem. We've talked about this many times before, but I'll say it again because it's still a shocking statistic, however many times we hear it. There's a 12-year difference in life expectancy between different wards in our borough. There's a real danger that this gap will become worse as a result of COVID-19. And Sir Michael Marmot spoke recently at an LGA webinar about the urgency of taking action to prevent this from happening. Dealing with the housing crisis was one of the measures that he specifically highlighted as crucial in this endeavour, and he emphasised that we should start today. So-called affordable housing won't solve this problem alone. We need social housing. One of the priorities that we regularly discuss at the Health and Wellbeing Board is the first 1,001 days. The logic is that the first 3 years of a child's life are a critical period in terms of development, and that by prioritising help to parents within this crucial window, we can improve outcomes for that child later in life. Access to appropriate housing is one of the most basic and important things we should be ensuring. Yet some of my colleagues have talked about already. They've got cases where they've been dealing with parents with very young children who've been on a housing waiting list for over 2,000 days. In the council plan that we'll be discussing later, I was really pleased to see that housing is listed as one of the key determinants of health. This is a well-known fact, it's not controversial, and actually it's already acknowledged in a lot of the work that we're doing. From a quick look at the data, it's obvious that the only way that we're going to be able to meet the goals that we've already set for ourselves is to build more social housing. So I hope this debate can set us on track as a constructive starting point to developing a more concrete plan to tackle this huge challenge.